It's Thursday. Welcome to Ask Melissa Almost Anything. We're on Facebook Live tonight where we talk about your life and your body, where we believe your health is your responsibility, that you always have a choice in where you go for your health care, and most importantly, where we believe that pain is not normal. I'm your host, Melissa, here for another Thursday night of Ask Me Anything You Want. Well, almost anything. No specific topic for tonight. So if you've got some things you want to know, let's not forget that I like to say I'm an expert in insurance by default. Have you ever wondered if your physical therapy is covered? Do you have questions about deductibles or copays? Do you wonder how your insurance works? Shockingly, I have been thrown into the deep end of that years ago as I own a clinic and understanding how those things work. So we can talk about any of those things tonight. However, what I want to talk about, and let's be honest, kind of looking to talk about anything besides COVID at this point. Is there anything else that we can talk about? I don't know. But what I want to talk about, oh goodness gracious, stop texting me, people. There's probably a way. I'm sure someone's going to tell me later there's a way that I can shut those things. Did you know that Nephew Physical Therapy has actually been open throughout the entire pandemic, throughout the entire shelter in place? I've been asked many times, are you essential? Well, I kind of think everybody is essential, right? Like if we're going to talk about human lives here, and I think what everybody does is essential because it's what, causes us to be who we are. But I can tell you that there was this in the middle of everything really starting to shut down, which was probably about March 16th. And if I've told you the story before, I guess you're just gonna have to stick through it again until I hear some questions pop up. But some of us were on spring break that week, and we were actually out of state. And after the governor had announced here in Michigan that the schools were closing, it was just a cascade effect of people stopping to do medical appointments, quitting, all of those kind of things. And so we made the decisions that we were going to close, which again was probably, March 16th, March 17th. Finished out our spring break, drove home, wasn't sure again what the world was going to look like, came home, said, okay, we're going to, push the pause button. Except we kind of didn't get to push the pause button because I don't know if you knew anybody who had surgery maybe the end of February or the beginning of March, but we knew people who had had knee replacements, major rotator cuff tears that were repaired, foot surgeries, hip surgeries, and some major car accidents that needed help. And I said, sure, I will come back, right? Let the whole team stay home, stay safe, do the unemployment. I will come back on, I'll come out of the dugout from retirement, not even that I was retired, but I'll come back and treat a few people, which was 2 or 3. Okay, I'll treat 2 or 3. My husband's home. He can help the kids with this new thing called, online homeschooling. But that's a story for another day. And so came in and saw 3 people. That quickly went to 5, then to 7. And within a few weeks, we were seeing, I had 10 to 12 active clients in a season where everything was closed. And it was challenging. I will tell you it was challenging because in that space, when it was just me and a patient, and I'm working, I'm thinking about a few of my favorites out there, and we're just working on their foot. And we're talking about life and the struggles that we're having as moms. So we're trying to figure out what's happening in the world and at home, and we're doing exercises and we're making progress, and we're helping somebody who had rotator cuff surgery who really just thought they were going to have to figure it out on their own at home. I was like, that not on my watch, right? I know what it takes to keep a shoulder going through rehab. I know that you need the hands-on help. You can't move that. Did you know rotator cuff surgery, most people can't even consider doing any type of motion on their own until 6 weeks? Sling, passive motion by a therapist, all of those things. It's a big deal to have a rotator cuff surgery, and it's a long rehab. And I would hate for somebody to go through that major surgery, all that pain, and not have a quality rehab process. So we started going. It got busier, so we said, okay, all right, team, it's more than I can handle right now. Who's coming back? Naomi said, I'm coming back. Joan said, I can help. Great. Brought her back. Within 2 weeks, she's full. She's seen a full caseload. 35 to 40 people a week. Okay, let's keep going. All right, I'm going to go back. I'm going to keep treating patients. Okay, let those doctors know. Let people know. So again, we were closed. Then we were closed, kinda. Then we were open, kinda. And I can tell you, Nephew Physical Therapy, which has been open all but maybe 6 days of this whole thing, is very much open and ready to go. We are bringing back another therapist next week. Woo-hoo! Christine is coming back. We're so excited. And I'll still be treating some patients. Naomi's treating, Christina's treating, and people are ready to come back. I couldn't tell you, if you're one of our clients right now, or you have been, maybe I should just stop and just say thank you. Maybe that's what we'll talk about tonight. If nobody has any questions to put in the chat. Again, if you've got some questions, let me know. I'll do my best to answer them. Pains, because remember, pain isn't normal. But if not, I'm going to say thank you. I am going to say thank you. I'm going to say thank you to our clients, first of all, who have come in, who have stayed healthy, praise the Lord, who, if they're not feeling well, have stayed home, who have done their exercises, who have heard from their doctor that they are doing better than expected with their shoulder rehab. Yes! Like, oh, I'm so excited. Like, that's amazing news. Who show up on time, who are thankful that we're there to serve them. I'm telling you, it has been one of the strangest time, for sure, of my professional career of being a physical therapist for 20 years. Certainly the most challenging time I've ever had in business over the last 14 years. But there was something odd when I walked in that building. I got past all the things that were going on in the world, and I just set it aside and said, you know what? I'm just going to help these people. And when I could just be in that moment, helping them, you know, working on a sore muscle, teaching them an exercise, guiding them through those steps, like, I could leave at the end of the day and go, thank you, Jesus. And I did. I sat in the car, I was like, wow, what a gift to be able to help people who are suffering and feel like they've been all alone. I can tell you that I saw somebody today in the clinic who became one of the casualties of this season. They were referred somewhere for therapy that was closed, so nobody ever got back to them. And they have been at home on their own, suffering for over a month. Thankfully, somebody they knew that we were open and sent them our way. So, yay for that. But I feel so bad. She's been suffering, and I am hopeful and positive and optimistic, like I usually am, that we're going to do our best to help her get back on her feet. But that's where we want people to know that sitting at home and suffering right now is that's not the plan. That is not the plan. We're wiping everything down. Space is good. If you can, we'll work you out outside. We're opening the windows. There's all those good things happening. So, and having been in the trenches for 2.5 months here, folks, I can see the signs that our patients we've been safe. We have been safe. Everybody has been well, has been healthy, and I praise the Lord for that. I really, really do. I mean, that is a gift from God. But let's remember, He owns Nephew Physical Therapy anyway. So I also want to thank just friends and family who have sent the people they know to us. Those interactions with our community recommended us and known that we're open, that have joined us here on Thursday nights, that have asked your questions. Like, thank you. Seriously, I every time somebody comes in and they're referred by somebody that I know, like, I take that responsibility so seriously. So seriously. So I'm really grateful for that. Again, if you're joining us and you have a question, don't forget to put it in the chat. Open line, open topic night tonight. Tell me about your aches and pains. Let's see if we can talk through it. Like I said earlier, if you've got some insurance questions, we can talk through that. I know most insurances fairly well. Did you know that physical therapy is pretty much, I don't want to say guaranteed, but every insurance plan covers it? It does. What it comes down to is your deductible, co-pays, and maybe a co-insurance. But we always figure that stuff out. So anyway, thank you to our clients. Thank you to the people who have sent them. And thank you to the physicians that have entrusted us. You know, there's a few that I have a relationship with, that I have been able to reach out to directly and connect with, to let them know that we're here. And that trust that's placed in us to take good care of the people that they're sending us, like that's a huge responsibility. And we have seen great success across the board here in the last, again, 2.5 months. Please, Jesus, let it end. So anyway, while it is challenging, to say the least, in what we have been through, I continue to see a glimmer of hope. And that's that challenge, right? Do we focus on the things we have impact on? Do we focus on the things that we can influence? Or do we focus on the things that are out of our control? There's a lot of things that are not within our control. But when a patient or a client or an individual walks into our office and maybe they happen to be home alone with their child because their spouse has to go off to work, and you make it work. You make it work so that baby gets to be with mom, or that Rhonda gets to help hold them. Like, these are things, I guess I don't even think of it. It's just what we do. And I'm not saying that because I'm trying to brag on anybody. It's just, it brought a big smile to my face that, I don't know, I guess I always say it's more than addressing your aches and pains, right? When we say that pain is not normal, we mean it. But we also know that when we're having aches and pains, headaches, knee pain, neck pain, whatever, there is such an emotional and mental toll that's placed on us. I've seen it on the faces of our clients where they kind of look like they've lost hope, especially in the midst of all of this, right? Like, this is not a simple thing. And if there's, if I can make an impact in one part of their life, that might be stopping them from working. That might be stopping them from going for things that they need now more than ever. Like, that's a blessing. Again, if you have a question, put it in the chat. Or I'll continue just to share some thoughts that I've had during this season. I want to point out, because it's illegal to touch my face. No, it's not. What was I thinking about? As we look forward to things opening up, right? And moving forward and slowly opening and, all that great stuff that keeps happening. I was asking myself, maybe talking to a client today, about what are we going to learn from this? And to me, as a healthcare provider who's all about keeping people moving, there's a couple things that, and I hate the idea of a new normal, but I do hope a new normal involves people washing their hands. I mean, come on, folks. Why did this have to be a thing? Why did we have to tell people to wash their hands with soap and water? Oh, I'm a mom of boys. Yes, I have told them millions of times. I will still remind them, wash your hands with soap and water. It is the easiest way to prevent the spread of disease. Stay home with your sick. Here's what I also know. If you were a client of us this winter and you walked into our office and you looked like doo-doo and you looked like you were sweating and had a fever, you were sent back out the door and a bottle of Lysol sprayed right behind you. We don't want sick people in our office. We don't want to get sick, right? So yes, those two things should continue to happen. Here's the big picture thing. And if was reviewing some numbers and survival rates, which is really, really good, which is why I'm optimistic, folks. If, God forbid, somebody were to get it, your survival rate is amazing. Praise the Lord for that, right? Here's the key, though, I think, in all of this, and this is where I questioned, is it too early to start talking about this kind of stuff? But what are the lessons we learned from this? We're not going to be able to stop aging, right? That's just going to happen. But how many of the diseases in our country are preventable or reversible? So we all know smoking is bad, right? What does smoking affect? It affects oxygenation of your blood, which makes your muscles healthy, right? It affects your lungs. Coronavirus is respiratory, correct? So we shouldn't be smoking. Okay, first of all, that should be obvious. heart disease, diabetes, goodness gracious, why are they all like blank? High blood pressure, cholesterol. These are things that with proper diet, exercise, sleep, vitamin D, sunshine, same thing, right? Water, mental health, relationship with God. These are things that we can do proactively to avoid getting sick. I can tell you that most winters, I don't think I get sick unless there are 3 things that happen. I don't get enough sleep. Okay, if I don't get enough sleep, I start to feel it in my throat, right? Because there's always germs out there, folks. Always germs. Always somebody's got something that's getting passed around. Secondly, water. If I don't get enough water, and I can tell you, I've really been needing it lately because I'm talking so much with clients, having water. The third thing, which I'll own it, is sugar. So if I combine those 3 things for me, that doesn't even talk about stress, by the way, which probably contributes as well. When I think about those 3 things, and sleep is the biggest thing for me. When I don't get enough sleep and I push myself too hard, crash and boom, right? I'm going to catch some bug that's in the air somewhere, okay? Now, do I think that doing all these things are going to stop somebody from getting the coronavirus? That's not what I'm saying, right? That is not, I'm not making that promise or that guarantee. What I am challenging the status quo on, folks, I am challenging this idea that we need to be sick to begin with, right? Now, we have to manage things, right? Type 1 diabetes, very different than type 2. Used to be called juvenile diabetes and sugar diabetes, right? Juvenile happens. There is not anything that you can do about that. It has happened. But I know people who manage that really, really well, and I know people who manage it poorly. Very healthy, very unhealthy, okay? So there's a difference there. High blood pressure and cholesterol, that is something that you can, for the most part, right? And I will not say 100%, because yes, there are some things that are genetic factors that affect these things, right? That factor in. However, right, being unhealthy is not a genetic thing, okay? It's why, oh man, I'm on this soapbox just talking to myself, talking to you who are listening, saying, here is the thing. We need to be able to move. We all know we need to exercise more. Well, maybe not everybody, but we need to move. And when we move regularly, we feel better. It connects to all of these other things that we're talking about, water, sunshine. We don't mention proper diet because everybody knows that, right? I mean, I always think, if I were to be healthy, what would I do? I would eat what Adam and Eve ate as much as I could, right? Because they didn't buy processed stuff or whatever. Fruits and veggies and grains and nuts and all that stuff. As long as you're not allergic to it, like me, right? More of that. Now, life gets busy and we come over here and we make unhealthy choices. That sucks. But we do these things. And so I would love to see a revolution come out of this. Not a political revolution, right? I would love to see a health revolution come out of this coronavirus, this COVID-19, this pandemic that says, I need to be healthy so that when my body is attacked with something that I can't control, there are things that I can be doing that I do have control over, what I put in my mouth, how much sleep I get, how much stress I'm under, how much water I consume, and the list goes on of things. You know, it's funny. I was actually on the CDC website the other day looking at what the recommendations are, okay? Because they're recommending all this stuff about COVID. There's about, I don't know, there's probably 1 million things on the website, because I didn't find everything, that they recommend people should do. Did you know that, right? It has recommendations on how much alcohol you can consume. But nobody's walking around shaming other people because they're having more. I think it says it recommends 1 beverage for women, 2 for men. I'm not a drinker, so, you know, that's how I feel about those things. That's what it recommends. So am I in the right if I go around and say, well, you're not following what the CDC says? No. See, this is the thing. There are recommendations all over the place, and we have decided just to focus on this one thing, and I am saying it is much bigger than that in regards to taking care of ourselves. When I say your health is your responsibility, we should be using our health care dollars for our health, not to be sick. I will repeat what I have said before. That's why I am spending healthcare dollars this year on mental health, doing proactive counseling, by the way, to work through some things that are creating barriers and blocks to me growing as a person. There are things that are getting in the way of me making good choices and healthy choices, both physically, mentally, spiritually. I'm doing that, right? I am spending that money because I have to meet my deductible. I am spending that on health care because the healthier I am here, the healthier the rest of my life is, honestly. And then the next thing I'm spending dollars on, which of course, was closed, is a health club, because I realized for me to be successful, which is why I've been struggling, I need to physically go somewhere, get some stuff done, and leave. Okay? Which is why there's so many different options in the world of exercise and health. Okay? You've got to find the thing that works for you. But I guess I just want to challenge us tonight. The challenge is that we need to all be taking better care of ourselves. Because without sounding arrogant, right? Again, age excluded. If I don't have high blood pressure, I'm not diabetic, I don't have high cholesterol, I'm not taking a list of meds for a variety of different, ailments of things and parts of my body that aren't working right. And again, this makes the assumption that some of these things could be reversed, because things can be reversed, folks, right? It's hard, stinking work to do it. It's hard to lose 5 pounds. It's really hard to lose 20 pounds, right? It's hard to go for a walk when you're tired at the end of the day. It's hard to get out of bed in the morning and hit your knees and pray and spend time with God. It's hard to choose water over pop. It's me. It's hard to not reach for the ice cream when I'm stressed out. It is hard to discipline ourselves. But the reward is so much greater. And so, while I don't say these things to be arrogant, again, during a time where there are people who are sick and ill and all those kind of things, but taking good care of myself during this time, increasing fruits and veggies and increasing my water consumption, increasing sleep, sitting in the sun, listening to the birds sing and the trees blowing in the wind has been as close as I'm going to get to a spa these days. So, and my closing thoughts for the night. If you are concerned about your health, and if one of those pieces is the fact that you can't move well because something in your body isn't working right? You have knee swelling, you have knee pain, you have numbness and tingling down your leg or arm, your neck gets stuck, you're not sleeping well because your back hurts, any of those kind of things, that is what I want to help you with. That is what the team at Nephew is here for. It is our job to work ourselves out of a job. It is our job to get in there, to figure out what we think is going on, and to guide you through the steps. You're going to have to do the work because it's hard, but we won't make you do it on your own. You will be guided through. So if you're having surgery because that knee just can't handle it anymore, okay, let's do that. But if you're young, which also might be your 60-year-olds, by the way, 70-year-olds, okay? If you've not had pain for a long period of time, you should get it looked at. Don't let it be something that's been bothering you for years and now you can't go to work because you've just been pushed right over the edge. Get to it earlier. We're talking about prevention here, folks. These are the things that we can do. It's why putting an emergency fund in place leading into this time where we knew it was going to be tough financially, having a reserve fund in place, both for the business and for at home, gives us a chance to breathe. Now, do I want to do this forever? No. But did I have to worry about putting food on the table? No. Why? Because we have scrimped and saved and sacrificed, not just in the short term, but for decades. Decades of sacrifice and setting things aside and planning for the what if, because we just never know. So we should be planning for the what if with our health. What if something were to attack our body. We should give our body every chance that it can fight when we're sick. Whether it's the flu, whether it's some other form of virus, whether it's kidney stones or back pain. These are things we need to be healthy. So friends, on a week when I'm tired and overwhelmed, I see hope. I see a light at the end of the tunnel. I see friends asking for help. I see our schedule growing, which gives me hope that people have hope once again, that life is starting to return to normal as we get out and enjoy this great Michigan sunshine, as we enjoy our beautiful state. Know, again, that we are here to help. Because remember, pain is not normal.